Streptococcus is obviously going to be a chain of cocci, which you can see on this picture on the right. They're a very large and diverse group. There's a lot of different species of Streptococcus bacteria. There's two classification systems that are used to classify them. The first one is the hemolytic groups. And then the second one is the Lancefield groups. I think these get a little bit confusing, so we'll explain them first and then we'll kind of put everything together on the next slide. So let's start with the hemolytic groups. So how they came up with these is that when you grow the Streptococcus bacteria on blood agar, which is just a culture media that they've added red blood cells to, we get some different patterns of hemolysis of the red blood cells. So the alpha hemolytic strep, they're going to partially hemolyze the red blood cells. So you can see the alpha hemolytic strep here on the top left. They've turned the blood agar kind of a greenish color. So that's what you get when you partially break down or partially hemolyze the red blood cells. The next group, the beta hemolytic strep, they're going to completely hemolyze the red blood cells. So you can see over here on the far right that the blood agar has turned pretty clear. So they have completely broken down the red blood cells. And then the last group would be the gamma hemolytic strep, or sometimes they're also called non-hemolytic strep. And that's on the bottom here. So the gamma hemolytic strep, they're not going to hemolyze the red blood cells at all. And so there's no change in color in the blood agar at all. And then these Lancefield groups, it's just named after the scientist that came up with this. What she did was that she noticed in the beta hemolytic group of strep, there were some different strains that the immune system acted differently to. And so she was able to identify those. So she just took the beta hemolytic strep and gave them some different letters. And so we have some of the human pathogens that are going to be in the group A and group B in the Lancefield groups. So here I've just kind of put everything together with the two classification systems that are used with Streptococcus just to try to hopefully make it a little bit more clear. So I've got the hemolytic groups. So alpha hemolytic strep, remember, is going to partially hemolyze the red blood cells. So it'll turn kind of a greenish color on the blood agar. And then beta hemolytic strep is going to completely hemolyze the red blood cells. So it'll turn the blood agar clear. And the beta hemolytic strep we can further categorize into these Lancefield groups, either group A or group B strep. So the group A strep, which sometimes they just abbreviate GAS, the example there is Streptococcus pyogenes, which we're going to talk about in a minute. And then the group B strep, or GBS, would be the abbreviation there, is Streptococcus agalactiae. And then the gamma hemolytic strep, or non-hemolytic strep, there's going to be no hemolysis or no breakdown of the red blood cells on the blood agar. And so there'll be no change in color at all on the blood agar with this kind of hemolytic strep. So I would know these for the exam. So this is pretty important. So there probably will be a question on this, just kind of a definition. You know, if I describe it, you can pick out, you know, what kind of hemolytic strep it might be. All right, so let's take a look at our Streptococcus. Looking at the beta hemolytic strep first. We've got Streptococcus pyogenes, which is an example of group A strep. And Streptococcus pyogenes, most famously, is the cause of strep throat. And so you can see that over here on the left. And I'm sure that all of us have probably had strep throat at some point. And so you get that really bad sore throat, it's really red back there. And then a lot of times people will get these little white patches in the back of their throat, but not always. And what those white patches are little pockets of pus. And so that's where the name pyogenes comes from. So pyo means pus, and gen means to produce. So that's kind of gross. All right, Streptococcus pyogenes, besides causing strep throat, if it gets into a cut in the skin, can also cause skin infections. It can also cause scarlet fever. This is just a rash that we can sometimes see that goes along with someone that has strep throat. They can also get a rash on their skin. And then we can also see rheumatic fever, which we'll talk about as a complication that we can see after someone's had strep throat. We don't see it very often, but sometimes we do. And the immune system gets a little confused in fighting off the Streptococcus pyogenes, and it starts attacking parts of the body like your heart valves. So that can cause some heart damage, for example. Streptococcus agalactiae, or group B strep, is a concern, especially in pregnant mothers. So this bacteria can live in the vagina, but it's not always there. It kind of comes and goes. And they will test mothers before delivery to see if the bacteria is there, and if it is, they will give mom antibiotics at the time of delivery to make sure that she doesn't pass this to the newborn during a vaginal delivery. Because if the newborn picks up this bacteria and it gets into the baby's lungs, it can cause pneumonia. If it gets into the bloodstream, it can cause sepsis, which is pretty serious and could kill the baby. And then it could also get into the meninges and cause meningitis as well. And then just some examples of non-beta hemolytic strep. You don't need to memorize that they're non-beta hemolytic strep, just don't worry about that. But we have Streptococcus pneumoniae, and that one's easy to remember. It's a cause of pneumococcal pneumonia. We worry about that in kids and older people, and there is a pneumococcal pneumonia vaccine to protect people against that. And then if you're going into dentistry, Streptococcus mutans, that is a cause of cavities. So you can see this tooth over here has a rather large cavity in it that was caused by Streptococcus mutans. Our next low GNC gram-positive bacteria is Enterococcus, and looking at the name, we have entero. So remember that means intestines, so it's going to be normally living in the GI tract. And remember that Enterococcus is one of our escape pathogens. And being one of the escape pathogens, antibiotic resistance is going to be a problem with this bacteria. And also it can cause some infections in hospitalized patients. So it can cause these nosocomial or healthcare associated infections. So maybe it gets into a surgery wound, it can cause UTIs, so it can cause some problems. Okay, and then our last gram-positive bacteria we're going to be talking about is Mycoplasma pneumoniae. And this one is a bit unusual. It does not have a cell wall, and it's the smallest bacteria that we know of so far. So you can see in the picture where this black arrow is, it's pointing to one of the Mycoplasma pneumoniae, and there's actually quite a few of the Mycoplasma pneumoniae kind of all throughout here. And this bigger cell here, that's one of our white blood cells, so you can kind of see the size difference. And Mycoplasma pneumoniae is so small you can't see it with a light microscope. You have to use an electron microscope. And because it doesn't have a cell wall, it's going to vary in shape or be pleomorphic. So the disease that it causes in people would be pneumonia, and that's pretty easy to remember because of the name.